Hello, my name is Alexander Morris, and welcome to my e-poster presentation titled Do Males and Females Exhibit the Same Physiological Stress Response to Medical School Exams? Medical students face a lot of stresses during their education, the most acute stressor of which is known to be examinations, which are unavoidable due to the need to measure knowledge and proficiency. It's known that acute stress may cause a number of physiological responses, including increased heart and respiratory rates. And these responses may differ between males and females. Trying to understand these stress responses in students may allow us to create targeted interventions in order to better benefit them. Our specific aims were to establish whether there is physiological evidence of stress in medical students during examinations using biometric measurements, and to examine whether these effects differ between male and females. We hypothesized that due to anticipatory stress, physiological stress may be worse in the moments before an examination starts, with a subsequent decrease once the examination begins. We further hypothesized that higher stress responses may be seen in female medical students. 20 osteopathic medical students were selected from a larger survey study to participate in this pilot study. 10 of these participants were born as and identified as male, and 10 were born as and identified as female. The medical students were given a Hexoskin Pro shirt, which is a biometric shirt containing ECG and respiratory sensors. The students were asked to wear these shirts during two separate examinations, which were taken 11 days apart, giving us 40 data points. Using the data from the shirts, we calculated the average heart rate and respiratory rates during the minute before an exam start time, the minute after the exam start, and 10 minutes after the exam start. We then performed two tailed paired t-tests, comparing the heart rates and respiratory rates at these three time points. The paired t-tests were repeated as subgroup analyses for male and female students. Lastly, we did two tailed independent t-tests comparing the heart rates and respiratory rates of male and female students. On the left is a picture of the Hexoskin Pro shirt, which was provided to all our participants. This shirt contains a bevy of sensors that allows you to take ECG readings from the participant, allowing you to measure heart rate as well as other metrics such as heart rate variability. It also lets you measure respirations, perspiration, physical activity, and even sleep if the student chose to wear the shirt. On the right is a picture of the Hexoskin dashboard as an example. We took the data from this dashboard and converted it into a CSV file, which allowed us to do our analysis. The first table of our results shows the difference in heart rate and respiratory rate at 1 minute prior to the exam start, 1 minute after the exam start, and 10 minutes after the exam starts for all of our students. It should be noted that we had a sample size of 38 for heart rate and a sample size of 36 for respiratory rate. Certain heart rate and respiratory rates were lost due to errors in the Hexoskin shirt. What we found is that there was a significant difference in heart rate for students 1 minute prior to the exam to their heart rate comparatively 10 minutes after the exam start, with a mean decrease of 5.62 beats per minute. We furthermore saw a significant difference in their heart rates 1 minute after the exam start to 10 minutes after the exam start, with a mean difference of 4.49 beats per minute as a decrease. However, we didn't see a significant difference in their heart rate 1 minute prior to the exam to 1 minute after the exam, and also in none of these time point comparisons saw a difference in respiratory rate for any students. The second table of our results shows the difference in heart rate and respiratory rate between male and female students at 1 minute prior to the exam start, 1 minute after the exam start, and 10 minutes after the exam start for both heart rate and respiratory rate. As you can see from this table, we found no significant difference between male and female students at any of the time points for any of the vital signs that we measured. This means that our previous hypothesis that female medical students may show higher physiological stress responses to these exams appears to be false. The next table of our results shows the difference in heart rate and respiratory rate at 1 minute prior to exam, 1 minute after exam, and 10 minutes after exam for solely male students, analogous to the first table we showed you, this time with a more restricted sample. And as you can see, we saw the same results as before, in that male students have a significant difference in their heart rate from 1 minute prior to the exam start to 10 minutes after the exam start, and 1 minute after the exam start to 10 minutes after the exam start, with no significant difference in the remaining heart rate comparison or any of the respiratory rate comparison. Our last table shows again the difference in heart rates and respiratory rates at our 3 time points. But this is for just the female student sample. And as you can see, we again see the same pattern as before, where there is a significant difference in heart rate 1 minute prior to the exam to 10 minutes after the exam, and 1 minute after the exam start to 10 minutes after the exam start, and no significant difference in any of our 4 other comparisons of interest. These results suggest that there is a significant decrease in osteopathic medical students' heart rates from the start of an exam to 10 minutes afterwards. The result appears to be generalizable between both male and female students and does not significantly differ between sex. The observed change in heart rate that we saw in our study is likely a physiological response to the stress and anxiety present at the beginnings of a high stakes examination. But once the students are further into exam, their heart rate lowers, which likely indicates they're now focused on the examination and no longer actively feeling stressed or worried about their performance. In other words, they're more in the zone and less concerned about their performance. While these results appear to be common sense based off of our common experience of undergoing high stakes examination, it provides with confirmation that there is a physiological stress response that we can measure, target, and then attempt to reduce with targeted interventions. Possible interventions for future study may include education and mindfulness techniques to use prior to an exam start, meditation, or other stress reducing methods. Thank you for listening.